Hi, I'm Kelly Farquharson, and I'm an associate professor at Florida State University. And I'm excited to be presenting at the Early Childhood Voices Conference and talking to you a little bit about how therapy group size influences dosage for school-based speech sound therapy sessions. And today I'll be presenting with two of the graduate students who worked on this project with me, Caitlin Fechtel and Shay Fitzgerald. We also have three other researchers who contributed to this project. Autumn McIlraith is our methodologist, and Sherine Tambyraja and Chris Constantino also contributed to the content. At Florida State University, I run the Children's Literacy and Speech Sound or CLASS Lab, and our mission is to help children with speech and language impairments achieve classroom success. We're available through various social media, so we're very active on Instagram, Facebook, and Twitter. My email address is posted there to continue our conversation. And I'm also linking our lab website where we post free articles, free PDF versions of our articles, and additional resources related to speech sound disorders, dyslexia, and developmental language disorder. So I'm going to turn it over to Caitlin.
So who are these SLPs that we're talking about? SLP or SLT stands for speech language pathologist or therapist. And we are the people who are providing speech and language therapy to children of all ages. However, we have the best outcomes when we can start treatment in early childhood. Therefore, if someone has a speech delay or disorder, their best possible outcomes are likely to occur if this issue is addressed during their early childhood years. A typical speech therapy session has a lot of variables that go into it. However, there are a few variables that can have a great impact on the session's effectiveness. Some of these include the size of the group that a child is seen in, the frequency and duration of the therapy sessions, and the dosage within the session itself. So a big point of emphasis here is dosage. So let's go ahead and define that. Dosage is considered an active ingredient that yields a change. We had therapists reporting their session's dosage ranged from 14 to 240 trials per session. As you can see, that is a huge range of trials. Current research recommends that a therapist achieves at least 100 trials per session. However, this recommendation of 100 trials does not take into account the large amount of constraints that are placed upon school-based SLPs in the US. So because of the large caseloads that exist in the United States, SLPs are usually seeing several children in a group. Once they start seeing more than one kid at a time, there is a large chance that the amount of trials each child gets is going to decrease. So now I'm going to turn it over to Shay.
So with all of that in mind, our current study aimed to consider the extent to which the size of a therapy group, meaning the number of students in a group at one time, will influence the dosage or number of target opportunities for each child, specifically in school-based speech sound treatment sessions. And to do so, we used the experience sampling method where data was collected in real time during a normal 5-day work week. Our study included a sample of 90 school-based speech pathologists from 42 different states across the United States. The SLPs included in the study provided treatment to children from preschool through high school, and the majority of sessions, about 76%, included children from preschool to 3rd grade, with ages ranging from 4 to 8 years old. And you can see the specific breakdown of the ages and the grade levels that were treated on the slides here. So this project included 2 phases. In phase 1, speech pathologists were first asked to complete a 20 to 25-minute demographic questionnaire that included information on their geographic location, practice patterns, and overall level of job satisfaction as school-based SLPs. In phase 2, those same speech pathologists participated in a series of brief surveys every day for one 5-day work week. The surveys were completed using a phone application called the Personal Analytics Companion, or PACO app. And the PACO app was programmed to randomly alert participants to take a 1-minute survey regarding the composition of a recent therapy session. These survey questions included information regarding group size, dosage, duration, and therapy targets. And participants were asked to complete up to 3 surveys per day over the course of that 5-day work week. And now I will hand it back over to Dr. Farquharson to discuss the results of the study.
So we'll start with our descriptive results, which are looking at the different components of the therapy sessions that the speech language pathologist reported. So the number of trials in these sessions ranged from 1 to 525. So that's an incredibly large range, as you can see. And then we also calculated the mean for that, which was 51. We looked at the average session length, which was 25 minutes on average. Most children were seen twice a week on average. And the average group size was 2 children in a group, meaning that 2 children were being seen for therapy at the same time. But as you can see, that ranged from 1 child to 12 children. So this is a really huge range here, and we were really interested in how this may influence dosage. We also asked the participants to report on what skills the other children in the group were working on. And when there was at least one other child in the group, that other child was also working on speech sound production only half of the time, meaning that the other half of the time, other children in the group are working on additional skills. So our next goal was then to run a linear mixed model analysis to examine the influence of group size on dosage. And we found that for every additional child that was added to a group, dosage decreased by 13 trials. So when we think about this goal of 100 trials per therapy session, the larger the group size gets, the harder it's going to be to attain that goal of 100 trials. And specifically, we found in this approach to studying this that trials decreased by 13 items for every additional child added to the group. So you can imagine for the group that included between 10 and 12 children that there was very, very low dosage in those sessions. So our conclusions are that group size negatively influences the dosage of speech sound therapy, and ultimately this can result in delayed improvements in speech sound production and a longer time in therapy. So if clinicians are only able to offer a low dose of speech sound intervention as a result of the group size, those children are likely to be in therapy for much longer as a result of the inability to practice their speech sounds for an appropriate dosage. So we have a few implications here, and the first one is for educators, which is to consider flexible options when working with your collaborating SLP to schedule speech therapy sessions that may afford the opportunity to see children in smaller groups. We also hope our SLP colleagues will consider smaller groups for speech sound therapy and also consider various service delivery models, such as a multi-tiered system of support, or MTSS, in which children are seen for longer periods, longer sessions in an overall shorter period of time. And so we hope that providing more opportunities to practice within sessions will also lead to early dismissal from therapy and ultimately reduce caseload sizes for very busy speech language pathologists. For parents, we hope that you'll take the time to practice your child's speech sound production at home, knowing that the size of the group that your child may be seen in at school could result in lower dosage during those sessions. And so the time that you're able to spend with them practicing is really going to help improve their outcomes. And for policymakers, we hope that you'll consider allocating funding to hire an appropriate number of SLPs so that group sizes can be smaller and ultimately we're able to implement more effective interventions for children. This project was funded by a planning grant from the Council on Research and Creativity here at FSU, which was awarded to me as the primary investigator and Dr. Constantino as the co-investigator. So our contact information is listed here. We hope that we'll be able to continue this conversation with you by you reaching out via social media or email. And thank you again for watching.